49-year-old female who's a florist who currently complains of pain in the right side of chest for the past few months. And it was insidious in onset and it was localized diffusely over the right side of chest and it increases on movement and was present continuously. It was not pleuritic in nature and there was no radiation. On examination, her thoracic spine exam showed painful restriction of movements. So she has a right-sided chest pain. So right-sided chest pain itself means that it is less likely to be cardiac. And
So,
then
where is the cardiac pain usually felt?
usually the cardiac chest pain would be left-sided or central.
No, no,
And
no. Cardiac pain is never left-sided. It is always
uh,
central.
central mainly, sir.
Central, not left-sided.
Certain books have given us left-sided, sir. That's it. Then the pain is insidious in onset and localized and for lasting for few months. So it suggests that it can be a malignant process or a specific maybe a metastasis or any other specific growth.
Okay.
And
So, when
it,
you say malignancy, metastasis, what are other symptoms you are likely to come through?
usually if it depends on whether the malignancy is on which layer. If it's in the skin, subcutaneous tissue, the muscle layer, or the bone, or the lung parenchyma, or the pleura.
Where do you localize this anatomically, this particular pain?
This particular pain, I would localize more on the bones, sir.
Bones.
And
So, what are the common diseases? Which bone you are talking about?
the ribs mainly.
Ribs. But rib pain increases on respiration. Here it is moving, increasing on
Yes, sir. It increases on movement, sir.
movement.
So
So,
it may be at the costochondral near the costochondral junction
okay. So,
or
how do you examine thoracic spine?
thoracic spine.
What
Usually
movement you look for?
the bucket handle and the uh, thoracic spine mainly the flexion extension and the lateral uh, flexion and extensions
That usually takes place in
lateral
lumbar spine, no?
lateral rotation.
Lateral rotation. So, that localizes in the thoracic spine. So, what are the common diseases affecting thoracic spine?
Yeah, it can be TB,
Yes.
any metastasis
Yes.
or any compression fractures,
Yes.
osteoporotic, and then it can be any local primary bone lesions.
You mean
Then
malignancy?
other malignancies can be
Okay.
the primary malignancies can be either osteogenic sarcoma, then
Okay.
other conditions. The
Osteogenic
metastasis,
sarcoma is a common site vertebra.
not much, sir.
Okay. So, what are the common sites of tuberculosis?
Tuberculosis.
Ah,
It can be the vertebra, mainly the paravertebral
no, no,
region.
no. Is it cervical, thoracic, lumbar, or sacral? Which vertebra is commonly affected?
Uh, I remember it's the thoracolumbar region, the junction,
Lumbosacral.
Ambrose sacral.
Thoracolumbar, L5S1. Sorry, T12L1.
Yes, sir.
T12L1. Okay. So, we'll go to the X-ray and see what happens.
Yes, sir. Yes.
Yes, two X-rays are
So,
there.
yes, sir. So this is an X-ray of the thoracic spine, which shows AP and lateral, and it shows. Uh, First of all, when while looking at this, we should make a clinical diagnosis whether on which vertebra would be affected. by palpating the spine initially.
No,
Then
no, no, no. X-ray wise, what's your opinion?
X-ray wise, mainly can't see any compression fractures.
No, what you
Mm,
can see, you tell. What you cannot see, you not tell. Is it normal or abnormal? After all, simple.
uh, there are anterior calcifications, sir. Some calcification on the anterior longitudinal ligament.
Anterior longitudinal ligament calcification.
Then there are peripheral osteosclerosis at the borders.
Osteosclerosis of the borders, yes.
Then no visible winking owl sign seen.
Which condition?
Usually winking owl sign seen in metastasis to vertebrae.
Metastasis. Pinking outside.
Yes,
Yes.
sir. Then yes, sir. That red area shows a calcification, sir, of
Calcification. Okay.
anterior longitudinal ligament.
What about the
Then,
AP view?
sir, I didn't hear.
In AP view, no?
Yeah, AP view shows lateral calcification also, sir. On the primarily on the
So, what you see here
uh,
is the flowing calcification of this vertebra, this vertebra, this vertebra, this vertebra, this vertebra. One, two, three, four. All on the right side. Flowing calcification connecting different vertebrae. Can you give a diagnosis now?
can it be dish, sir?
And here you find is the osteophytes, and here you find possibly this is getting calcified.
Can it be dish?
It is on the right side only. So, what is this?
Diffuse idiopathic skeletal hyperostosis.
That is the full form definition.
Yes, sir. Mainly, uh, uh, I I don't quite remember the full details, sir.
It is a
It is a non-inflammatory calcification uh, or ossification of the spinal ligaments, more predominantly seen in the males.
what are the usual symptoms?
Usually, the usual symptoms would be pain in the thoracic spine, uh, dysphagia,
No morning
and
stiffness.
no morning stiffness.
No.
The morning stiffness, if it was present, may suggest ankylosing spondylitis, mainly in a middle-aged male,
No,
especially.
no. Morning stiffness indicates
Uh,
inflammatory
in,
disease,
inflammatory.
not ankylosing spondylitis. Okay.
Yes.
Dysphagia and myelopathy. How do you get dysphagia in these patients?
Dysphagia can be due to any compression to the esophagus
By what?
by the calcified
Okay.
ligament.
Okay, right.
So X-ray thoracic spine findings, as we saw, there was anterior as well as a right uh, longitudinal ligament calcifications. Usually, the typical finding would be a candle wax flowing, a flowing calcification and ossification of the anterolateral aspect of the vertebral bodies. At least two consecutive vertebrae needs to be involved.
Commonly right side. That's why right
Oh,
side pain. It is
yes, sir.
unilateral, not like ankylosing spondylitis bilateral. Okay, what's the differential diagnosis here?
Differential diagnosis would be cervical spondylosis or lumbar spondylosis.
How will
Then
you, how will you differentiate?
usually there would be specific osteophytes
That's
in
true. And
and all
osteophytes will be
disc group
usually horizontal,
horizontal, sir.
not
Yes, sir.
flowing calcification. And cervical spondylosis, cervical spine may become straight, and
Yes,
posterior longitudinal calcification.
yes, sir. And the characteristic radiological feature would be absence of the posterior longitudinal ligament calcification, sir. and
and osteophytes.
osteophytes.
How do you treat this patient?
Um, Supportive management,
Symptomatic management.
and
Okay.
paracetamol, states intraarticular steroids, sir.
Okay.
Usually, any myelopathy or any uh, vertebral spinal condition which causes bladder and bowel involvement, a severe uh, a non-resolving myelopathy, uh, dysphagia, myelopathy, radiculopathy.
These are the three indications for surgery in dish.
Yes, sir.
Okay. Reverse
So,
surgery. Okay. So this is a case of dish. Person has right-sided chest pain, and she has visited 18 different doctors.
oh,
So the importance of making a diagnosis, you tell the prognosis, you explain to them what it is, and give symptomatic treatment, they get well. Otherwise, they're panicking, they go from doctor to doctor saying, I got pain, no relief. And patient is thinking about some malignancy in their subconscious mind and become
yes, sir.
very much disturbed.
Yes, sir.
Is it okay?
Yes, yes.
Let's go to next case.
Yes, sir.